Hi, I'm Terry Harper at Spa Medical, and I have a young patient here who will be getting Botox for the first time. So I'm going to talk to you a little bit about Botox for beginners. The first thing we're doing is Molly has told me the areas that she's interested in treating, and I even suggested an additional area that she may not have noticed. But Molly came because she's interested in this. Can you frown real hard for me? This area right here. And she's starting to make a little line there in her early 20s. But the other thing that is that I noticed on Molly, and almost everybody has some asymmetry in their face, especially noticeable in their brow area. So when we look at Molly's brow, her right brow sits a little bit higher than her left. So a lot of people don't know that Botox may be able to help that as well, because Botox basically is adjust the pulley system of the facial muscles that can make some areas go up and other areas go down as needed. So one of the first things I'm going to find out about Molly before we even go any further, because the one big contraindication with somebody Molly's age is going to be pregnancy or nursing a baby. Are you pregnant or nursing a baby?
I'm not.
Okay, so we get that out of the way. Now let's talk about exactly what Botox will do for Molly. Basically, Botox is going to make a little temporary communication disruption from the nerve and the muscle. So when the nerve can't tell the muscle to move, the muscle doesn't move. When the muscle doesn't move, the skin doesn't crunch into lines. And so, voila, you have nice, smooth skin. So Botox statistically is going to take 3 to 4 days before it even kicks in. So Molly can have her treatment today. She can walk out and go to dinner tonight or wherever, and nobody will ever know she's had anything done. In about that 3 to 4 day period, sometimes day 5, a week, I'm not surprised at, but the majority of the people are going to have it before day 5. She's going to be unable to move the muscle areas that I'm treating. Now, you might think, oh gosh, I don't want to not move anything because then I'll look unnatural. Well, the areas that we need to maintain mobility in order to keep natural expressions, we're going to keep. But I usually tell my patients, I could talk to you all day long and you may not be able to tell the one area that I can't move at all, because I can still lift my eyebrows, and that's what gives expression. So my goal in treating Molly or myself or anybody else with Botox is to maintain the most natural expressions possible. In fact, so much so that nobody would look at you and say, she's had Botox. So that's the goal here, to be very natural, and I'm also very conservative with it. We can always come back and add a little bit more if needed. So I would tell Molly to get rid of this area here. She is going to have about 5 little pricks in the skin, the tiniest little needle. It does go through the skin. And in about 3 or 4, maybe 5 days, she's going to then be unable to do this unless she does it or I do it with my fingers for her. Now, with this left brow, this muscle that goes from the brow up to the forehead lifts the brow up. That's the muscle that I want to maintain, because I want her to still maintain the ability to lift her eyebrows. That's what gives expression. But the muscle that goes all the way around the eye is a muscle that tends to want to pull down. So I'm going to relax that muscle from pulling down with a little bit of Botox so that I can get that brow up and more equal with her right brow. Everybody, like I said, has a little bit of asymmetry, but that's the art of Botox, is trying to manipulate the muscles to create more perfect symmetry. Now, what should Molly expect after her treatment? I use a very, very concentrated dosage of Botox, which means the amount of liquid that I actually have to inject is very small. So it is likely that she would leave here and not have no residual notice at all that she's had anything injected. She will not leave here with big whelps on her skin. Sometimes some of you may have had some Botox that has occurred. That is not the case here, because again, I'm injecting the tiniest amount of volume. So she may have no sign whatsoever of ever having had any procedure done. which is a great thing because a lot of people come on their lunch hour and they go back to work and nobody ever knows. She can put some powder right back on. I would have to wipe it off to do the treatment, but she could apply it directly before she leaves here. The other thing she should expect that I would tell her is within about 3 to 4 months is the typical time, again, statistically, that she's going to need another treatment. The best time to retreat is before the muscle gets full strength again. So we're wanting to keep that muscle relaxed. And at Molly's young age, if we are able to keep her muscle in a relaxed state, she will never have lines etched in the skin from having done this so many times because the muscle is not going to be able to do that. So by starting young, she's going to get some short-term benefit from her Botox, but she's also going to get long-term benefit. So when she's my age, she's not going to have any little lines etched on her skin, which would be remarkable. Come in for a free consultation and let me manipulate some of your facial muscles.